Hi, my name's Dr. Chris Milkie, founder of Milwaukee Feet Clinic. Today I'm going to talk about nail problems, toenail problems. Wow, so many things can go wrong with toenails. Other than aesthetics, we really don't need toenails for anything, but the problems that arise from toenails is just incredible. So let's start, first of all, with just the simplest thing, which is cutting your toenails. How should you cut your toenails? Well, the saying is cut them straight across, and that really is the case. The idea behind that is to not go into the corners and end up with a problem like an ingrown toenail. So proper toenail cutting can go a long way towards not having a toenail condition. Um, Toenail fungus, one of the most common things that we see in the feet in general, and just a really unfortunate situation. Our feet are in a bad environment. Being in shoes all the time, it's warm, it's dark, it's moist, is just a bad environment. We wash our socks, we don't wash our shoes. So, unfortunately, shoes can harbor viruses, bacteria, fungus, those kinds of things. So, the environment is not great. But then you add that to the fact that there is the genetic component, which is the number one reason why people get toenail fungus. Toenail fungus is extremely common. What does it look like? It looks like yellow, white, and often thickening of a nail or multiple nails. And unfortunately, sometimes all 10 nails can get it. It can happen in childhood, it can happen in middle age, it can happen in the senior years. Anytime in life, a person can get toenail fungus. And again, the genetic predisposition is there. So there's families that often get toenail fungus. And besides the color changes, it can be painful because of some thickness, and sometimes the fungus can cause an ingrown toenail. That can be a problem as well. And an injury can cause toenail fungus. So I have patients that come in all the time that said, my nails are perfectly normal. I dropped something on the toe, or the nail came off because of hiking or whatever. And then after that, it grew back with some thickness and discoloration. And they realized that there was something else going on here besides just an injured toenail. So we had to address that. Here's the unfortunate part about toenail fungus. Home remedies do like almost zero to toenail fungus. All the remedies you can get from a retail place do almost zero for a toenail fungus. You can go online and find tons of things that are touted to be treatments for toenail fungus. And 31 years of experience, I can tell you that none of those things work. Can it help a little bit? Sure. Is it going to solve the toenail fungus? Absolutely not. It often takes, and this is kind of unfortunate, but it often takes one full year for toenails to go back to normal if they're treated correctly. Number one, got to get the diagnosis right. Got to make sure it's toenail fungus and not something else causing the discoloration and thickness, like maybe what's called psoriatic nails or protein in the nails. It's a keratin problem. So as long as we know the right diagnosis, then the proper designed treatment plan and being intentional about really following through with the plan for oftentimes one full year. Again, it takes a while for the toenails to get better. The end result can be very, very good. Nails that you want to hide, and now nails that you're willing to show in public and wear sandals and be barefoot around the pools and things like that. So toenail fungus is treatable. Nothing's 100% in medicine, but the right treatment plan can go a long way towards having really good nails. Again, wasting time and money on anything retail, over the counter, Amazon, what have you, is really just going to be a waste of time and money. So certainly don't recommend that. Another thing that can go wrong with toenails is just a discoloration, like a darker purple, almost like a bruise. And it's concerning because people are concerned about melanoma. And it should be a concern. Anytime there's a discoloration that all of a sudden happens, you didn't have an injury, you don't have any clue as to why, it should be evaluated by a podiatrist to make sure that it's just a bruise. And we see a lot of bruises under toenails, big toenail, any of the smaller toenails. A bruise can happen from hiking, running, just having shoes on. I mean, people don't realize that just having shoes on sometimes causes pressure on the toenails, and you can end up with a bruised toenail. So you don't want to just disregard that. Anything that happens to the nails that doesn't look right, doesn't feel right, should be addressed no matter what the age. And certainly if a person has diabetes, they should even be more concerned because unfortunately their body doesn't heal as well. And a small problem in a toenail can lead to a very big problem. I've actually seen where a toe had to be amputated because of an infection that was just ignored. Ingrown toenails, another topic, very, very common. Again, the young, the middle, the old, I mean, anybody can get an ingrown toenail. And again, another genetic predisposition. There's families that have this. And it's often not shoes and it's not activities, it's genetics. And that's why we see a lot of, 10-year-olds and 15-year-olds that come in with that, as well as adults. Something that would be easy to do, what we call bathroom surgery, not recommended. If you can get a little piece out, fine, but you don't want to go digging because I've seen plenty of infections from that. Ingrown toenails are very solvable and really curable for that matter if, again, treated the right way. There's a specific treatment that we do as podiatrists to help cure that condition. So, number one, just any kind of pain in the corner of a nail or anywhere around the nail where you don't really know where the pain's coming from often can be an ingrown toenail. And it may not really show up as an ingrown toenail where it's red and it's infected. It might just hurt. Well, that's oftentimes an ingrown toenail and certainly should be addressed. Again, any pain or discoloration around a toe that's going on for a long time should be addressed by a podiatrist. But an ingrown toenail is very treatable. If it gets red and irritated, we use an oral antibiotic. Certainly, soaking and topical Neosporin and triple antibiotic ointment, things like that can be helpful. But the bottom line is that there's a very mild thing that we can do right in the office to solve that problem long term. So, those are some of the really common things that we see with toenails. And again, toenails can really be a problem and they can cause pain. There's a problem that develops in toenails called keratin or protein buildup. You wouldn't know that different from what looks like toenail fungus, but we do because we see it all the time. So that's something that has to be diagnosed appropriately so that you're not being put on antifungal medications and things like that for something that really isn't even fungus. So, obviously the trained eye, the 31 years of training for me personally goes a long way towards looking at a toenail, in many cases being able to say it's this or it's that. So toenails sometimes don't hurt, but don't look good. That should be addressed. Toenails sometimes hurt. That should be addressed. And again, just anything in general that you're not comfortable with trying to take care of yourself and, wasting money on over-the-counter products and things like that should be addressed by a podiatrist. So that's it.